Welcome to Elevated Practice, where we interview masters and mavericks within the field of holistic medicine and uncover unconventional stories in the field of health and wellness. I'm your host, Gretchen Badami, and every episode I'll be interviewing clinicians, scholars, entrepreneurs, and educators who share their wisdom and ideas with you. Are you ready to elevate your practice? Let's begin today's episode. I'd like to extend a big thank you to Handcraft Health for sponsoring Elevated Practice and empowering integrative healthcare practitioners to create personalized healthcare packages for their patients. Create a free account today and elevate your practice at www.handcraft.health. And now, on to today's episode. Hello and welcome. Dr. Shiroko Sokitch is a board-certified acupuncture physician and functional medicine doctor who has been in practice for over 30 years, an integrative physician who blends Chinese medicine and conventional Western techniques to help complex medical patients find healing and wellness. She was a surgical resident for 2 years and worked as an ER doctor for 10 years. She specializes in healing trauma and providing compassionate care. She created the Disaster Recovery Summit as a charitable summit for disaster victims, as well as having hosted integrative healing programs on public access television and writing news columns on health advice. Her book, Healing When It Seems Impossible, is a culmination of her distinctive blend of all that Western medicine and Eastern medicine have to offer for both the patient and the practitioner when dealing with chronic, mysterious, or difficult conditions. Dr. Shiroko, welcome. Thank you so much for being here with us today.
Thank you for that beautiful introduction. I'm honored.
Well, I am honored. It's so wonderful to have you here because you have such a unique personal story that I'd love to talk about a little bit more. You have a blend in your background and in your practice of two traditions that at first thought may seem antithetical, but really, as you've discovered, have been quite complementary in treating patients. So I'd love to talk about that a little bit more. And first, I'd love to hear about what inspired you to become a doctor. What originally brought you to Western medicine?
Well, it's when I was a kid, my parents split up when I was 3 and my mom left my dad and I never saw him again until I was an adult. We lived with my grandmother after age 3 for a while. This is in Germany. And my great grandmother was the person who took care of me, and she was my closest ally, friend, support person. And I spent most of my free time with her. One day I was visiting her and she lived right next door to my grandma. She collapsed and I couldn't wake her up. And I remember little snippets of it where the ambulance came and they lifted her through her window because the door was too small to go to the hospital, and she died. And I remember when my mom told me that she was dead, or she said her heart stopped beating. And in that moment, of course, there was devastation because she was my closest person. And at the same time, there was this there's got to be something that will fix her. And I started trying to imagine okay, her heart stopped beating. So I literally started thinking about how to make her heart beat. And so that was the day that I decided to become a doctor. I wanted to fix that. And since then, there's this built-in drive that I have for miracles and to always look for miracles and to find the thing that will solve it. And so the first time I got to save a life was in surgery. And I was on an ER rotation as a third-year medical student, which is very, very crazy. But I remember a patient who came in with a gunshot wound, and I got to go to the operating room and we saved his life. His wound was in his heart, and we plugged his heart and we saved him. And I was like, oh my God, we can save lives. And so that's why I went into surgery. Was that was this amazing thing that we could do. So when I went into surgery residency, that was what I was looking for, was how to save lives. And then a bunch of things began to happen in my own life, I think, because I'd finally achieved my lifelong dream at age 25.
In hearing that story, I'm sorry to just pause you for a moment, but your medical journey, this trauma that you went through as a 5-year-old and the noble calling that you were immediately inspired with is a tragic and beautiful story. And I just want to emphasize that wow, you spend your life training to be a doctor, you go to med school, you get yourself into surgery, you're in the ER, and then at 25, you do it.
Yeah.
Okay. So What next?
Hey, what next? Well, then I had to start thinking about who I was, and some of the traumas of my life began to come up. A lot of people tell me this story of they achieve their lifelong dreams, and then their emotions begin to show up. And it's common around age 27 ish, this moment of questioning the purpose of their lives, which started for me in my second year of my residency. I just began to question, is this really what I wanted to do? And I remember my surgery attendings used to say that you have to want this more than anything. And I wanted to be a doctor more than anything. But when I began to look, I didn't love surgery. I loved saving lives and changing lives. But that's not always what's happening in surgery. And so I began to question that. And so I took a month off during the summer of that residency, and it was an unpaid month off. And I started was to think about that. And I remember I got sick immediately, and I spent several days with a high fever and a bad headache. And I was visiting my mom, and she just let me lay in my room to be sick. And I remember I had a dream, and it was, if you stay in surgery, you will die. Literally like banner. And I've always had some sort of guidance, and sometimes it's that over where it says, if you do this, but other times it's very subtle. So that was pretty clear. And so I started thinking, well, what do I do? And I didn't know, but that voice was powerful in my experience. And so I listened to it. So I remember I told my chief, I said, I think I'm going to be leaving the residency at the end of this year. And I was offered other residencies pretty quickly, but nothing really drew me. And then somebody gave me this book, The Web That Has No Weaver, Chinese
Of
medicine.
course. Yeah.
Yeah. Oh my goodness. And I started to read it, and it was like I couldn't put it down. It was like something woke up in me. And then, one thing just led to another. I was spending a lot of time in the county hospital in Seattle, and one of the respiratory therapists had just finished acupuncture school. And he talked to me about it, and he kind of became my mentor. Well, I had never had acupuncture, so I went to him and I tried it, and doors just kept opening in that direction. And he told me there was an acupuncture school in Seattle, so I went to look at it and signed up. I actually ended up teaching their Western medicine course, and every semester I was like, why am I doing this? I've been a doctor for 2 years now. What am I doing? And every time I'd ask that question, and something would happen that would like us keep going to school. So I did. I went to school, and then I decided I wanted to open a clinic, and I moved to California. So here I am.
Wow. Wow. So for those who are listening who may not be familiar with The Web That Has No Weaver, Ted Kapchuk, who wrote that book, and was this the early 1990s?
I left my residency in 1986, and I finished acupuncture school in 1990. Yeah.
Okay. Yes. So one of the first books that was made available to the general public here in America about the general philosophies and an overview of Chinese medicine, the philosophy, the Eastern thought that underlies that entire medical system. So you were given this book. It changed the trajectory of your medical career, and you found yourself finishing up your time for the next decade in the ER while learning Chinese medicine. And I have to say now, I've worked in acupuncture schools for about 15 years. I've seen a handful of MDs enter the school, leave the school. Most doctors who are interested in this medicine don't actually learn the entirety of the medicine and go through the program because it is full-time, 3 to 4 years. There is so much to learn. And at this point in time, we do have the ability for Western medical doctors who are interested in acupuncture to take some weekend courses and put in some needles. But you went through the entirety of the schooling. You went through the schooling that a TCM practitioner or an acupuncturist, what they would have done with the herbs, with the entirety of the philosophy and the acupuncture. I just want to point out that that was quite grueling, what you went through while you were in the ER.
I had a lot of experience being a student.
And before we get into talking about your current practice, I first am very interested to know, with the medical background and working in the ER, as you were learning about this medicine, what sorts of things did you find to be inspiring or useful in the ER?
This is in the 80s, right? So none of the functional medicine testing that we now have available was available then. And in conventional medicine, you don't use it, right? You use standard medical testing. So from the very beginning of my career, there was a lot of people who had issues that were not diagnosed by the standard testing that we had available. And so what I love about Chinese medicine, and I'm still in love with Chinese medicine this many years later, is this ability to look at what's going on and understand it from the energetic perspective. As I was learning it, I would see these people in the ER and, okay, I didn't know how to take pulses yet, but I practiced taking pulses. I had the privilege of 50 patients a day in the ER where I could feel their pulses and I could check their bodies and think about it, not just from the Western perspective, but also from the Chinese perspective. And sometimes it's really obvious, somebody has a gunshot wound to their leg, what's wrong, right? But if somebody has some mysterious symptoms and none of the tests show anything, I could say, oh, this fits this pattern. And I could begin to understand what was happening to people without a Western diagnosis. And so I was able to give people information about themselves that they could understand and that made sense. Because one of the things I love about Chinese medicine is that it makes sense based on what's going on with somebody. And I feel like I was lucky because I was young and I still had that open mind, or maybe I've always had that open mind because I still do. But I had the open mind to take the information I was learning from Chinese medicine and bring it together with the Western medicine. And so I was able to find answers for people when maybe there weren't. Chinese medicine has a broader picture and it has a broader picture of what's going on. And I've always felt like if doctors knew this, even if they don't practice acupuncture, but they understood this principle of Chinese medicine and the energy and how the body works, it would be so helpful to them. It's beyond functional medicine because functional medicine still relies on testing and labs and take this supplement, take this thing. But Chinese medicine gives you this energetic perspective that's beyond that.
Isn't that the beauty? When we had spoke a couple weeks ago, and one of the things you had mentioned that you appreciated as MD studying holistic medicine and Chinese medicine was that you didn't need a diagnosis. And even though we see now functional medicine has become a hot button term, everybody's talking about functional medicine now, but it still does require a diagnosis, or it has the idea that, well, we'll just strengthen this person. But Chinese medicine really does have the ability to make a diagnosis based on patterns that don't require lab tests, that don't require to pinpoint exactly what bacteria or exactly what virus, et cetera, et cetera. And so you were the OG functional medicine practitioner. You were discovering this back in the early 90s.
Yeah.
When you decided to leave the ER and open up your own medical practice, incorporating everything that you learned and the tools from your Western medical background and what you had learned from Chinese medicine, what did your practice look like? What tools did you use and how did you incorporate those things together in the beginning?
Well, it's always been an evolution. My lifelong quest is miracles. And seriously, that is how I have approached when I see somebody. I'm always looking for what is that one thing that's going to make them better. So I'm always studying, always researching, always looking for that still. And when I first started, all I knew was Western medicine and acupuncture or Chinese medicine. And so I just worked from that perspective. So I would use Western medicine, if there was a tool that was needed. And I've always looked at somebody first from the Chinese medicine perspective, and I used acupuncture and some Chinese herbs. And then as I began to learn about functional medicine, actually in the early 90s, probably the first thing that I noticed is if somebody does not have energy, nothing works. And so even with Chinese medicine, if you don't have any qi, nothing's going to work. Even acupuncture is not going to work. I began to notice when people came to me with severe fatigue or really low in energy, I had to boost their energy first. One of the first things I learned was hormones. Because if you have hormones, then you kind of get qi. So probably the biggest discovery after opening my center and starting to work with people is that I had to make sure that they had any energy before they started further treatment. And just recently, I'm taking care of a woman who's in her early 50s and she's had severe diarrhea for years and almost can't keep anything down. I did the stool test and I also did a hormone test, but the stool test came back first. So I started trying to treat that. And as soon as I started treating what was in her stool test, she got a rash and she got very annoyed and she didn't want to deal with the rash. And so she stopped all those supplements. And then we looked at her hormones and there's nothing.
Wow.
Like nothing, no adrenal hormones, no estrogen, progesterone, to stop, nothing. So I gave her a bunch of hormones and she's getting better.
She has the tools within her body now to create energy.
Yeah. And she was surprised because I think she was still annoyed when she came in and, I hadn't fixed her yet in 1 month, but she's just emailed me and said, I'm starting to feel better. What's going on? I'm like, well, you got hormones. Over the year, experiences with different patients and the studies that I do have shown like both are needed. You don't leave one out. You need Western medicine, you need Chinese medicine. The functional medicine is a nice in between because it looks at things differently than Western medicine, but also differently than Chinese medicine. But I think they all blend it beautifully. And I love that I can do all of it.
Yes. Now people can take functional medicine courses. Practitioners can go and do a deep dive and take all these weekend courses to learn this. But you were learning it gradually and applying what you knew from Western medicine and what you were learning from the Chinese medicine philosophy and theory. Such a great example. We know that patients need qi, they need blood, they need yin, they need yang. You were recognizing that these are the hormones in a sense, and certainly other things within the body. And that's easier to explain in some cases to patients than telling them that they're yang deficient. So you were able to translate this medicine for your patients. And here you were doing this 30 years ago.
Yeah. In my book, I actually talk about the physical element of getting well. And I think there's, 3 main elements of getting well is the emotional, the spiritual, and the physical, and that you can never separate them out. But also in the physical, your hormones, your nervous system, and your immune system, if you translate Chinese medicine into that, from the yin and yang and all that, those 3 elements I call the triangle of wellness. If you get those 3 elements in balance, then you can heal. And fixing whatever, the infection or the Lyme disease, whatever it is that we say is there, if you get this working, then the body can do it. And that's really the main principle of Chinese medicine, right? But I've translated it to Western understandings. So I offer everybody the opportunity to speak to me for free for 15 minutes. And then there is an emotional and spiritual component, something I love about Chinese medicine because it's in there. It's built in. And most disease either comes from inside or outside your body. And everything from outside your body is an infection, which again has to get permission to get into your body, which is your immune system. Yeah. So basically your body lets stuff in. Why does it do that? Ultimately, emotions. They talk about the 7 emotions that allow things to come into your body. And so that's, again, why I love acupuncture, is because you don't even have to talk about your emotions. Once I deal with whatever meridian's out of balance, that emotion is going to either come up or be treated or dealt with. What I explain is just how Chinese medicine works and that whole idea of the triangle of wellness. I just got another new patient last week who is having a really hard time, but she's had 1 visit and she's like, I'm not better. I'm like, you had 1 visit. You don't have an easy problem.
You have a problem that has been building up for probably a decade. It's not going to be fixed in 1 visit.
And she's been sick for at least 2 years. So I talk about how long it takes to heal and what a healing journey is versus what a, fix it now journey is. A lot of conditions that people develop, they're not simple. They're not take this antibiotic and it'll go away, or put a cast on your leg and it'll go away. It's the level of toxicity of our diet, the level of toxicity of our environment, and the damage that stress does to hormones. All of those things are playing a part in how somebody is feeling. And it's never just one thing anymore, and maybe it never was, but it seems that when I went to medical school, things were a little more simple than they are now.
Yes, we have all of these outside invaders from the food and the environment and all the toxins. And how do we even begin to combat an idea like microplastics, right? We could have so many conversations about all of the different things that we have to do now. And you've seen all this change over 30 years. You touched on something that I know you focus on in your practice, and it really is at the heart of holistic medicine, Chinese medicine, which is the idea of emotions and how that connects with the idea of trauma and how you identify that and how you work with that. By the time this podcast airs, which will probably be in the spring of 25, we have just had over the past 6 months, a multitude of disasters which have caused deep physical, spiritual, and emotional trauma for people. And I'm going to speak here to the United States because this is where we are. But first with the floods and the hurricanes in North Carolina, and now with the fires in Southern California, in Los Angeles, you living in Northern California have a history of treating trauma and doing disaster relief with the fires in Northern California. I'd like to ask you about this and hear about some of your work. Let's pause for a moment to extend a big thank you to our sponsor, Handcraft Health. I prescribe a lot of herbal medicine in my practice, and quite frankly, I don't want to spend the overhead keeping hundreds of herbs and supplements on hand. Since the pandemic, I do a lot of telehealth consults and ship patients their prescriptions. Handcraft Health has been my lifesaver. It allows me to have a successful and streamlined practice and saves me money and office space. I am not tech savvy, but the platform is really straightforward for me to write and easy for my patients to pay online and receive their orders at home. It's free for practitioners to open a Handcraft Health account. It's just handcraft.health and only takes a few minutes to sign up. It's one of the easiest choices you'll make to do what you do best. And now, back to our episode.
Sure. So in 2017, when we had fires that burned down over 6,000 homes, between 20 and 30 of my patients lost their homes, and the fires came within a mile of my office. The immediate thought was, wow, first of all, toxins, breathing that air, because the air here was like for a couple of weeks. And then the emotional trauma, and people had to escape their homes. I had patients who told me the flames are coming to take my home and I have to run out and find my cat and get out in a minute. It's miraculous to me that more people, because it came in the middle of the night. They're like storms. And one lady was telling me, like, literally the flames were coming at 70 miles an hour towards her house. And luckily she woke up, because it was 3 a.m. and she heard something, and she woke up and she looked outside, and this big wall of flames was coming towards her house, and they got out. Luckily, I mean, they were alive. That's similar to what's happened in California, in Southern California recently. So there's that life or death moment. I put together a summit because there's the financial consequences, but then there's all the emotional, spiritual, physical consequences of inhaling smoke, being exposed to mold. So I put together a summit, and Health Means is a company that puts on summits, and they did it for free, which is amazing. They organized it. They did all the tech. Wow. They made it happen. It's on their site, but it also created a little booklet that has all of the hints and suggestions of what to do in these different situations. So that's on my website. And actually I have uploaded all of the videos, and I'm creating that as well.
And I usually ask at the end of the podcast, but since we're talking about it right now, your website, it's hearttoheartmedicalcenter.com for people who need information ASAP. And I know it's too much to go into here, but could you give a few key considerations? Acutely, when someone first experiences the trauma and the fire, and they have all of the logistical things to deal with, and their body is in shock, treating them then versus treating them later. Any brief advice that you'd like to give for practitioners? And certainly there, unfortunately, will be more fires to come, I am sure, in this new age of climate disasters that we live in.
Flooding, hurricanes, and fires. One of the first things I learned actually from a homeopath many years ago was that there's a homeopathic remedy called aconite, Aconitum napellum, and it helps when you have such a big trauma. She told me about it in light of bombings that had happened in Bali, and she was saying that there were a bunch of homeopaths that were there, and they went to the ER because when you have a trauma that like where you have to escape your home in the middle of the night, or you are flooded out and you can't go home, or somebody tries to kill you with your car, anything like that, it knocks you out of your body.
Yeah.
Your spirit gets knocked out, and the aconite brings you back. And for me, it was one of the most remarkable remedies of my life, because she told me about it, and I went and got the remedy and I took it, and it felt like for the first time in my life, I didn't have a certain level of fear that I'd had my whole life, because I think I was born in trauma. And it just took it away instantly. I recommend it for people who have had surgery, because you get knocked out of your body when you have surgery, or a trauma, or a car accident or any sort of thing that could knock you out. So that is simple. It's called Aconitum napellum, and you can get it at Whole Foods. And it comes in 30C, but I like 200C. That's one thing. The second thing is taking care of your adrenals, because again, that level of stress kind of knocks you out. So vitamin C. And vitamin C has a multi effect because it can help your immune system, help your connective tissue, but also it supports your adrenals under stress. Holy basil is my favorite herb for adrenals. I call it holy basil Batman. It helps your adrenals. And in Chinese medicine, we call emperor herbs, which are smart. They find what the body needs and help. So the emperor herbs are those herbs that know what you need and you can always take them and they're not going to harm you because they find where the help is needed. So holy basil, a lot of Westerners think about ashwagandha because that's the one that everybody knows about.
Yes.
But holy basil, I think, is even better and not as well known.
And holy basil is that the same as tulsi, I believe, in
Yeah.
Ayurveda? Okay.
Yeah.
And with these herbs that you're talking about that have this ability, nowadays people are referring to those as adaptogens, right? Where they
Yes.
help your body adapt to stresses and traumas and also deficiencies, and they can help you come back to homeostasis. I think
Yeah.
that word is being thrown around a lot these days, adaptogenic effects.
Adaptogenic. And I have a video on that on my YouTube channel. So holy basil, ashwagandha, rhodiola, they're all adaptogenic herbs and they're all amazing. There are formulas that have all three. Ginseng is also in that list, although I think ginseng's a little more intense.
Yeah.
So I think taking some sort of adaptogenic herb, taking vitamin C and glutathione. And glutathione helps detox, and it's also a super antioxidant. You can buy glutathione in all forms. You can buy it as capsules or as a gel that is called liposomal. The science is a little better on liposomal. I'm just going to give this as information so that people can use it. There's a website called consumerlabs.com and it tests supplements. So it's kind of like the Consumer Reports for supplements, and it gives a lot of information about what works and what doesn't and what quality different labels of supplements are. And it's a very inexpensive subscription. If you're a practitioner, you should know about it and you should look at it. The best quality glutathione, according to that site, is pure encapsulation for the price and what it is. It's a liposomal. Pure encapsulations makes it, and it is in a capsule, which some of the liposomes are this gel that are just disgusting because glutathione is sulfur. So detox pathways, it helps carry every molecule of a toxin uses up one molecule of glutathione. So it carries the toxin through its path. It walks it out of your body, basically. And it's good for your respiratory system. I have patients who have recurrent respiratory issues, and taking glutathione helps their breathing, which when you're inhaling smoke, that's a good thing. So it does a lot of different things, and it protects you against toxins sort of in a generic way because it's an antioxidant. So if you just did that, would be helpful. 4 things in the aconite and the 3 supplements would make a huge difference during a high stress moment.
So the high stress, someone has just lost their home or they've just experienced a flood and their body is just shooting out adrenaline for days or however long after this event, this trauma. We've just talked about some of the acute things that you can do with the aconite, homeopathics, vitamin C, adaptogenic, emperor herbs to bring the body to a homeostasis. What next as a practitioner? You have a patient who's coming in to see you weekly and get acupuncture. They have PTSD, their emotions, they have it deep in the body. How do you address that?
Well, I created a series of acupuncture treatments, 7 treatments that are for PTSD, and they're for removing the trauma from the cellular memory. And some of them are treatments that I learned through the different disciplines of acupuncture. So I put together 7 of them in a series that helps remove that from a person's physical, energetic body. I've been using it now for about 12 years, and it's amazing in how much it helps. I remember one woman who came to see me. She was having severe vaginal bleeding in perimenopause. And she told me this story of how her son was killed in Iraq. And that's when the bleeding started. And I'm like, well, this is because you lost your son, you lost your child. And she looked at me like I was crazy. No, it's a hormone problem. And I'm like, okay, let's try these treatments. So the first treatment I did, it changed her life. She actually left my office without making a follow-up appointment. So I called her a week later and I was like, are you okay? What happened? And she said, you changed my life. I didn't believe you when you said it. And so she came for the rest of the treatments, and she had been working at Whole Foods doing something menial. She had been unable to move forward with her life. Her son had died 2 or 3 years before. The bleeding stopped. She got out of Whole Foods and started a career that she had dreamt of, and it changed everything. And she got into a relationship because she hadn't been in a relationship, and she found a man that she felt a connection with. And she had been stuck in this place where her son died, right? And she was able to move forward. So a lot of people who experience the type of trauma that's like a fire or a flood, first of all, there's this emergency response. So it's different, right? You don't have time for PTSD. You have to find a place to live. You have to get your ducks lined up. You have a lot to do in a short period of time, and it's an emergency situation. And so in that period of time, this is what I learned after our fires, is people didn't have time to think about trauma. So now, 7 years later, the people who are here are feeling the trauma of the fires in Southern California. And they're like, I can't sleep. And it's not their fear for themselves. It's the post-traumatic experience of when they had to run from their home in the middle of the night. Now it's coming up. I remember another patient of mine that I had at the time, he had been in the fires in Oakland, I think 10 or 15 years before that. And he lost his home at that time. And when we had our fires, he was like, I'm feeling it now. So a lot of times the trauma, the moment, the PTSD element doesn't show up until after, when you're safe.
So for people who are listening to this, don't think you're too late to treat the trauma. It's probably just about the time to start trying to move some of that before it settles for too long in the body.
Yeah, that list of supplements will really help. That's an immediate thing you can do and that you don't have to think about. And it's part of the emergency, take care of yourself sort of thing. But the PTSD element, it's never too late to do that.
Yeah. And I'm thinking at the moment about these fires and these disasters. This brings to mind another very large and very needy population of our veterans who have had the honor of serving our country, whether they're in war or in dangerous situations, and who come back and more often than not experience extreme PTSD after their time of service. I don't know if you've treated a lot of veterans in your area, but have you seen these methods able to work for veterans with PTSD as well, or
I
are
haven't
there
seen a lot of
differences?
veterans, but there is a 5-point ear acupuncture treatment. Do you know about this?
With the NADA protocol?
The NADA protocol. So the doctor who created the program for doctors, his name is Joseph Helms. First, I used to scorn that because it doesn't go deep into Chinese medicine, but he has worked with the VA, and those 5 points are used on veterans. And there was a movie that I featured Andrew Weil. I think it's called Backfire, but it talks about trauma and the veterans, and it talks about how wounded veterans are flown from Iraq to Germany to be in the hospital, and the level of pain and the amount of medications that they're taking in this 5 needles stop them from having to take medication. And they showed in the video, they showed these bags of drugs that these people were on, and then doing these treatments no longer needed. And I met a woman last spring, this beautiful woman. She works in the VA in Virginia or something. She's an acupuncturist. She's part Ukrainian. So she went to Ukraine and she is teaching people how to do these treatments. And she's running clinics and helping the people who are traumatized by being in the war there. And she's taken her life into her own hands. And she told me about it because I just was blown away by her courage and her willingness to do this. She does this 5-needle treatment on the ears, and it helps these people get out of trauma. So this is another way of dealing with trauma that they're using for the military, and that she's using in Ukraine, and much easier than my 7 treatments here.
Well, it's good to have multiple tools in your toolbox. And so, yes, if you're just seeing someone once.
So Joseph Helms is taking it on to teach in the military hospitals, lay people how to do these treatments, and that you can do 10 people in a room, just put 10 needles, 5 needles in each ear, and they can sit there for an hour. It helps them stay off medications. It helps them deal with stress. It helps them feel better. Miraculous.
Yeah, that's a good reminder, because while there will be a lot of people listening to us who are acupuncturists and who will be able to have an ongoing relationship with patients, giving them acupuncture with a full understanding of the theory and the channels, even if there are other holistic practitioners such as naturopaths or chiropractors or other people who could get certified in doing the NADA protocols if they have a situation where they need to be treating trauma. That's a very good reminder.
She invited me to go with her to Ukraine. I felt so bad that I couldn't make that happen. She has the courage. She was in an apartment that was within inches of being bombed. And she said she feels divinely protected. But every place she's been, she has somehow not been injured. And I pray for her that that continues.
Wow. Many of us will not have the opportunity to go somewhere like that. But with ongoing natural disasters and environmental and climate disasters increasing, this is an area of practice that is extremely relevant for anyone who is a doctor. You've really been able to highlight today that people who have a holistic practice can really treat and get to the roots of the trauma, the PTSD, the emotional imbalance that is the root of our ongoing physical problems and chronic disease. Thank you for that.
My pleasure.
I could talk to you all day long, and unfortunately, we can't. We're going to have to do a follow-up episode at some point in the future where we can go more in depth into some of these things. I did want to ask, for practitioners who want to share their knowledge, you've written books, and I know that you have a physical book that you've written, and you have some ebooks. You also give presentations. What inspired you? Do you have any advice to practitioners who want to share, or what inspired you to start doing that or going about that process? Do people reach out to you? You have a good network for this? How do you do that?
I don't know. Honestly, I have spent a lot of energy trying to reach out to people more. And so I'm not the best at that. To be honest, I wrote my book because it was in me, healing when it seems impossible. And it took years. And I wrote my column, my newspaper column, because I wanted people to have access. So I think my drive is to help people have access to healing and to help people achieve miracles. What does it take to be well, to heal? But it's not just physically well, but to feel well, to love your life. Because wellness is not just not having pain. In fact, sometimes I have pain in my body every day, but I still enjoy my life, So what is it? And that's my search for healing, my search for helping people. And I want to share it. So I find ways. So I do a weekly Facebook Live that is now my YouTube channel. And so it's a bunch of stuff on my YouTube channel. Sometimes I'll do acupressure points for people. And sometimes I'll talk about supplements. I love hormones. So I talk about hormones a lot. You do what you're driven to do, right?
Putting the information out there, and then people will find it.
Whoever is meant to find it finds it. I've had people come see me from Australia and from Singapore. I had a lady come from London. I don't know how she found me.
Well, you treat people, and what they see as a miracle occurs. You provide healing that they did not expect to happen because they were so distraught and they had tried everything else, and that is their miracle. And then they're going to share that, right? Word of mouth. That's how I found you, was word of mouth, through someone who appreciated your work. You've been doing this now for over 3 decades. If you were to look back at your younger self 30 years ago, maybe that person who was still in the ER or just out into practice, do you have any advice that you would give to yourself, either to avoid mistakes that you've made or to make it easier on yourself or to give yourself a pat on the back? What advice would you give your younger self?
I had a big ego. That's why I was a surgeon, and I couldn't let myself be a family practice doctor. So I had a big ego, right? And I think the thing that I would tell my younger self is to drop my ego and to really just learn to listen. Even if the advice that you're given or the guidance that you're given, you don't follow, but to really just take in anything. Like if life is giving you information or teaching you something, and, there were places where I listened, but there were lots of places I didn't. A lot of our ego is connected to our own traumas, right? So I had a lot of my own traumas in my life and in my experiences, and my traumas affected me. but they also affected my patients. So I think the thing that I would take back or do better is to listen better and to really have a more open heart. That takes time to learn to heal yourself, right? So the number one thing here is not the physical, but the emotional. And it's to bring love. The reason my business is called Heart to Heart Medical Center is because it's about love. All healing is based in love and care. And I think that was the big lesson I learned in the last 15 years, is how much love impacted my own healing. So I call it Heart to Heart because I love my patients, and I give them the opportunity to meet me for free because I want them to feel, do they have that connection with me or do they need someone else? Because it's a connection, it's a process. When you go on a journey of healing, most people who come to me have had problems for a long time or they're difficult, and it's more than just the physical. So the love is the number one ingredient. It's also the number one ingredient you need in order to look at your own life, in order to heal. So the first key in my 7 keys is love. It's not take this medicine or take this supplement.
That is such good advice. I really needed to hear that today. So thank you. And that is relevant to every single, not even just practitioner, I think probably human out there. That's universal advice. So thank you.
Oh, thank you. Thank you for listening to me and inviting me. I love talking to you.
Lastly, before we go, I've enjoyed getting to talk to you and learn about your life and what you do. Is there anything in talking about self-love and being healthy? Is there anything that you do prescriptively on a regular basis? You are so vibrant and your spirit is so clear and you look healthy to me. What do you do for yourself to keep yourself healthy, mind and body?
I dance. That brings me joy. So I think important is to find joy wherever you can and to really find the things that you love. I say one of my speeches that I've given is fall in love with your life. Fall in love with your life. Find something to fall in love with. And for me, for a long time, it was a struggle to find what I love. Well, there's certain things I love. Like I love cooking a really nice meal for friends. I love dancing. And I've really gotten into it in the last year and a half. But I exercise every day. So one of the things that I've learned over the years is for me to release what I take from patients, I have to move. I have to exercise, and my body needs a lot of movement. Most people do, I work putting needles in people and going from room to room all day long. So I'm moving all day, but I also exercise, and I do all different kinds of exercise. And over the years, I've done different kinds because as we change hormonally, we have to move differently too. So exercise and 80-20 healthy meals. So there's got to be pleasure in life, whatever it takes to have some pleasure and to enjoy life to some degree. And then the right foods, the right supplements. I'm 67, so you know my age. And I take hormones, and that helps me have energy. And I take certain supplements that feel good to my body. And so that's another chapter in here, is listening to your body and finding what's right for you. And how do you do that? How do you listen? How do you learn to tune in? It's about finding balance. I have emotional support from friends, people who I love and they love me. I have dancing, I get to help people every day. So all those things make a difference.
You're doing so much that you love and brings you joy. And I love that example of dancing. That's a good one.
I love
It's
it.
joyful exercise, right? Thank you so much for being here. For our listeners who want to find you, again, that was hearttoheartmedicalcenter.com. This is Dr. Shiroko Sokitch, and you have a few books and a few ebooks online for practitioners and for patients. I think that both for our listeners who are practitioners and for our listeners who are just interested in learning more about holistic medicine, functional medicine, Chinese medicine, there's going to be a lot of information here that people are really going to appreciate. So thank you.
So just so you know, my next book is actually Sailing Through Surgery. Because I was a surgeon, I feel like I'm uniquely qualified to have that in between. And I've helped a lot of people get through surgery in a way that's not traumatic and helpful and life-changing.
Thank you. We will have you return for that and talk about that in the future. Thank you so much for being here today.
Thank you for having me.
That's all for today's episode of Elevated Practice. I'd like to express my gratitude to our guests today and always for sharing their wisdom with all our listeners. I hope you were able to take away some insights, practical knowledge, or inspirational ideas that you can apply right away to elevate your own practice. You can find us on Spotify, Apple Podcasts, and YouTube. Don't forget to subscribe and tell your friends and colleagues about elevated practice. If you have an idea for an episode or a recommendation for a guest, please respond in the comments or message me, Gretchen Badami, directly through social media. Thank you, and I can't wait for you to hear our next episode.